you so much, and it's a great pleasure to be in front of so many of you here. Every single month it seems like our Lunch and Learns continue to grow in terms of participants, and I just am very thankful that all of you have taken the time out of your days to come and be a part of our different series that we have here. As part of that, if you ever have any suggestions about something that you want to know more about, a topic that you'd like to hear us focus on, please let us know that too, because what we're here to do is to best serve our public, to help to promote a healthier patient population, and really some of the best ways to do that is just through these types of informal educational opportunities where we can talk openly about different topics. And so I'm up for anything. So if you want to give me any different no, those of you that know me and that have been to these presentations also know that. So anything that you want to talk about, I am an open book to it. The purpose of all of this, and I just really feel like this is important to always kind of go through and state, is that the Lunch and Learns that we're presenting here at HIMG and even our Facebook Live that we host monthly, the purpose of all of this is really designed to provide basic health information. So oftentimes whenever we're seeing our doctors, our primary care providers, our mind may just not be on what it may need to be on, focusing on our own individual health. What can we do to kind of better ourselves? What's one thing that we can take away from this time with our provider to kind of give us greater knowledge and understanding of our medical condition, of ourselves as a whole? And so the real purpose of this is to give you information, very basic information that can help you improve your quality of life, okay? And this is especially true whenever we're talking about arthritis. The resources that I have been selecting for these presentations are not going to be academic ones that you would see me presenting on at Marshall or at conferences. This is applicable, accessible resources that I'm using that you could go home today and learn more. Find out more from it. So that way it makes it so much easier for us to know about a reliable resource that then we can use as part of this like assistive tool. And so with that being said, so much of the information that we're going to be talking about today does come from the Arthritis Foundation. And if you have access to a computer or have a library card, I'm a big fan of libraries, go there, check out this resource because it has just a wealth of information that can really be very assistive to us long term. So just as an overview, these are the three areas that we're going to kind of be focusing on. What exactly is arthritis? And understanding our treatment options. Because as we talk to other people who have this condition, they may have a different treatment plan than you do. And you might be wondering, well, why are they doing this and why am I getting that? This will hopefully provide you with some answers about that, as well as some different things that you might be able to incorporate as part of your own personal treatment plan to improve your health as well. And then we're going to talk about the living aspect with this, because life with any medical condition continues on past diagnosis, right? And we have to be able and willing to see how that adjustment takes place within us over the course of our lives. Many of you know who have been in this before. I'm actually a type 1 diabetic, and so this is a lifelong chronic condition. I live with it every single day. And so the understanding that comes with having a condition like that is one thing that I try to bring to these presentations as part of that, because I consider myself living with diabetes, that it doesn't necessarily have me. This is a condition that I have as part of my life. So with that being said, that's one of the things that we'll focus on as part of this too. So what is arthritis? Focusing on some basic facts about this, it's actually a general term. So whenever you say you have arthritis, that's not necessarily specific to what type you have and how that affects your treatment plan, how that affects your quality of life as a whole. Did you know that there are over 100 different types of arthritis? Did anybody know that? No. Huge, right? Huge surprise that it comes with all of this. Number 3, this is a big and important fact too. Again, I think so much whenever we think of arthritis, we think of it as like an aging disease, right? It's not. You can be diagnosed with arthritis at any age. One of my very best friends actually has rheumatoid arthritis, and her daughter, who is 4 now, I think was diagnosed at age 2 with that same condition. okay? She's the happiest, brightest, spunkiest little girl you ever did see. Again, this child is living with this condition because of knowing these different types of treatment plans, and because in a lot of ways her mom has served as a pretty good role model for her too. So that's what this is about, is finding ways that we can kind of work with these conditions. But don't just think that it's just an aging disease is kind of the point with it. Arthritis is actually the leading cause of disability in the United States. Is that a shock to some people too? So, sure. And with arthritis, there are other comorbidities that often come along with that, right? Approximately 47 to 51% of those who have arthritis also have heart disease and also have diabetes. Both of those conditions can make it harder to treat arthritis. So again, as we're talking about your own understanding of your condition and your treatment plan, it's important to know what other medical conditions you may have and how that can affect your quality of life and care plan, all right? With that being said, depression, that's actually the most common comorbidity that comes along with arthritis. And those of you that have arthritis or know somebody that does, the way that this can kind of affect your quality of life, your engagement in activities, your social involvement, it's all very much a part of that as well. Symptoms. Symptoms of arthritis can vary, but just in general, what we're looking at is joint pain, swelling, stiffness, the things that we think are all very commonly associated with this. Difficulties in range of motion, okay? So shoulders, elbows, knees, different things like that, your hips, okay? Any part of your body that allows you to kind of move, if you're noticing any changes or difficulties within that, that could be a symptom of arthritis, okay? And as we talk about in this presentation, if you start to notice that you have these symptoms, one of the best things that we can do is go to our primary care doctor and start to have this discussion with them. Because with this condition, there are modifiable things that we can do to help to slow down its progression, to help to improve our quality of life, and in some cases can make treatments much more effective as well, okay? So be mindful of that. Symptoms may be mild or severe, right? Some people say, well, that depends on the weather, as we'll talk about later. That can actually be true for some folks, okay? And that it changes over time. So with any condition that we have, our experience with it, the condition itself as it manifests and changes with us as we age. And so it's important that we have a good understanding of what our symptoms are and how they can kind of impact us. Now, as we mentioned, there are over 100 different types of arthritis, and the Arthritis Foundation actually goes through all of them. So you can get lost in that rabbit hole pretty quick because it's actually pretty fascinating whenever it talks about these. But what we're going to do is just focus on these main two kind of components right here. So whenever we typically think of arthritis, we think of osteo or degenerative. And what that basically is the wearing away of the cartilage on the ends of the bones, which causes some amount of friction, okay? So we know cartilage is in our nose, it's in our ears. It's this nice little protective kind of material, in a sense, that really helps us whenever it comes down to impact, all right? It helps us when it comes to smoothness in terms of range of motion and all those things. Whenever we are looking at risk factors for this type of arthritis, again, the foundation here identifies these four things: excessive weight, family history, age, and history of injury. And a lot of times we may think back at our life whenever we start to become symptomatic of arthritis and say, well, I haven't hurt or injured myself. I haven't fallen. I haven't had any big kind of accident that's occurred. This history of injury dates back to whenever you were a kid. Okay? Right. Good idea. Great, right? So, I mean, many of us, if that we, especially back then, as youth, we tend to live a more active lifestyle than what kids do these days. And so what you were doing at that point in time, if it had a high risk of injury or if it involved a lot of repetitive movements, even as your work career, like working in a factory and you're always kind of doing the same repetitive motion. That's what we're kind of talking about with this. A lot of times whenever I'm working with arthritis patients and they're getting ready to go through surgeries or things like that, and I ask them, well, what's your injury history? And he's like, well, I played baseball. I said, were you a catcher? Yes. That's all you're doing. That's all you're doing, right? And so that's what we're kind of thinking about whenever it comes to this. So we can't outlook what happened to us as a kid and the injuries that took place during that time, as well as our work history as being part of that disease process. This type of arthritis can be prevented by staying active, maintaining a healthy weight, avoiding injury, right, as much as possible, and repetitive movements. All right. Now, for some of us, we're like, well, I've already got that diagnosis, so it's too late. Not necessarily. And as we'll talk about through this presentation, decreasing our experience with pain, improving our mobility, and our quality of life is all modifiable by working on some of these factors that we'll kind of go over. I know, right? Pretty cool, huh? So, whenever we're talking about inflammatory, the most common type is rheumatoid arthritis. And some of you may have that condition as well. This one is actually more visible a lot of times than other forms of arthritis, especially in like the fingers and in other joints. This is actually an autoimmune response, okay? So the body's immune system then starts to attack the joints. All right, so that's not our fault, right? We have an so we kind of get a bye on that one, right? I have a type 1 diabetes, autoimmune, I get a bye. But the risk factors can be genetic or environmental. And the most common one that is identified throughout the research over and over again when it comes to rheumatoid arthritis is smoking. Isn't that interesting? So, I mean, we often think of smoking just in terms of our lungs, maybe in terms of our heart. We don't often think of it in terms of our experience of arthritis. But that is absolutely one of the factors that they've identified within those who have rheumatoid arthritis. So, modifiable behavior, again, working on ways to kind of promote smoking cessation is going to be a part of it. Early diagnosis is helping in slowing disease progression. Okay, it's helping. It's a helpful thing that we want to kind of consider. And so, whenever you start to notice any symptom of arthritis, again, going to your primary care provider and talking to them about this kind of stuff is really what's going to be very assistive whenever it comes to early diagnosis. Other types, just to kind of mention, infectious. This is caused by organisms that attack the joints. Some things that have been identified as contributing to that could be a history even of STDs as well as hepatitis C. So we don't often think of infectious diseases as triggering arthritis, but I mean, again, it can. And then we have metabolic, and this is the uric acid buildup that can happen within our body. This one is very different in terms of its experience of pain, though. And so if you have this type of arthritis, you probably know it. Because what the uric acid eventually does is it causes these awful like crystals that form within your actual joints themselves. And it almost, instead of having this like long-term kind of chronic aching pain that has different levels of severity with it, you get this really, really sharp, extreme, they describe it as almost like a needle kind of feeling, right? Okay, you got, all right. Is that pretty accurate description then? Okay. Very different, very painful, terrifying, and can be very debilitating with that too. And so it's a different type. But this can also be related and correlated with episodes of gout. And so, I mean, who wants to have an episode of gout going on whenever you got this kind of pain, right? But you often see these two things happening at once, okay? Or that one will happen and the other, can kind of trigger it as well. So we'll spend a little bit of time discussing that as well. So how is arthritis diagnosed? Through going to your PCP, your primary care provider, whoever that person is. And last month in our Facebook Live, we had one of our primary care providers, our nurse practitioner, Mary Vaughn, on. And one of the most important things that we can do is to have a well-established relationship with our primary care provider, because that person really serves as the hub for everything that we need for our health, whether that be emotional, cardiac, endocrine, whatever. They are the source that's going to help us to find the most effective path to wellness. And so we want to make sure that we have a good established relationship with them, that we like them, and that we feel comfortable talking to them, and that we are taking advantage of making the most of that visit, okay? So if you are noticing these different symptoms and reporting them to your primary care provider, what you can likely expect is first a physical exam, because sometimes, again, the swelling of the joints can be an indicator for it, and that can be just seen. They can also see it sometimes, right, as we kind of talked about, and some of the nodding that can kind of take place. They may ask you some questions about your family history, and no matter who we are, understanding or having a general idea of what conditions we may already be genetically predisposed to can be very helpful in identifying what's going on with us in this moment. So if you haven't yet, talking or kind of being an investigator into your own family history is really important with this. Lab tests are often done, and this is done to see the levels of inflammation, okay? And it's also done to check for antibodies. And so that can also be a part of your treatment plan in determining this. Imaging scans, most common is going to be an X-ray. Sometimes they may order an MRI. It just kind of depends on what the physician is thinking at that time. You could also have referrals. Most common is to a rheumatologist, especially for inflammatory types of arthritis. Sometimes, if we're looking at more of things that could be handled surgically, you're going to get referred to an orthopedic surgeon for evaluation, treatment as part of that as well. The biggest thing that whenever it comes to whatever your treatment plan is that's been prescribed to you by any of these providers is really following through with it. And whenever it comes to a surgical procedure, making sure that you follow through with that aftercare plan is critical in your long-term success, especially whenever it comes to arthritis, okay? So if they have that order for physical therapy, showing up for that physical therapy is what is going to be the most helpful long-term preventative strategy in improving your quality of life, getting your mobility back, and decreasing your chances of having some other things kind of go on. So, big fan. Any questions about that? Does that seem like pretty common, what most folks have experienced with this? Again, if you're going to be walking into your doctor's office and talking to them about your symptoms, this is what you can kind of expect to have happen in terms of your initial course of care, okay? Blood. They're just going to draw some blood, and they're going to look at antibodies, inflammation factors. Sometimes they'll look at your liver functioning, your kidney functioning. A lot of times they'll do a complete metabolic panel just to kind of check overall wellness with things.
What about the A1C test?
A1C is done for diabetes, and you know that's something that's should be a part of all of our care plans to happen at different intervals. If we're pre-diabetic, a lot of times they want that done about once every 6 months or so, at least annually. But you know, diabetes is one of my favorite things to talk about, so we have a different group here.
We look for C-reactive protein.
Sometimes, any type of those different antibody types of responses and things like that with it. So you want to make sure that the lab results, they're going to be pretty comprehensive, but that's going to be based upon what you're also reporting in terms of your family history and what your physical presentation is with these things, okay? Because as we kind of talked about with rheumatoid arthritis specifically, we do tend to see more of a genetic follow through in that, so having that kind of good recall of what your family has went through.
Autoimmune? You know, and when I think about that, I think about lupus or something that I never would have.
That's an interesting thing about rheumatoid arthritis is that, yeah, it's the body's just attacking the joints. I mean, our body's a very interesting mechanical machine, you know what I mean, just kind of process. And it's designed to do certain things. And sometimes those things just malfunction. And in those cases, whenever that happens, the best things that we can do for ourselves is to make sure that we're taking care of some of those modifiable risk factors that can make it much worse. So with lupus, a lot of times what you're wanting to do is to be very mindful of what triggers some of your flare-ups. And so learning that type of whole process, trying to, again, modify what you're doing so that way you can still continue in doing things, but not to a point where it's going to exhaust you, cause further impairment or whatever else. With type 1 diabetes, it's the same thing. So I can take my insulin all the time, but if I'm not living a healthy, active lifestyle, if I'm not eating well, then I'm still going to be on a lovely roller coaster that's not going to be very helpful or effective for me long term. So whenever it comes to these modifiable risk factors, the Arthritis Foundation specifically mentions these 3 things related to these 2 different types of arthritis. Beginning with the first one, we want to maintain that healthy weight. And the reason for that is, again, we're talking about something that's kind of providing that type of cushion right within things. And if we think about, like, I don't know, a mattress, that's a cushion. A pillow is a cushion. Whenever they start to get flatter, whenever they start to become uncomfortable, right? It's done from a lot of wear, it's done from a lot of tear, it's done from a lot of compression and kind of weight with things. Our shoes, we do a pretty good job of changing those because the cushioning in them starts to kind of go away, right? Well, that's kind of what happens to our body, is that the more weight that we put on it, that cushion starts to kind of deflate in a sense, right? And making it kind of the easiest way. And then it just starts to rub. And so you can almost feel that type of, like, patients will describe it as like a grinding, type of effect on it. Or just this horrific kind of ache or just swelling and type of pain with it. And so working on maintaining some type of healthy weight, talking with your primary care provider about what your healthy weight range is within that's important. Last month, our Lunch and Learn that we talked about was on emotional eating. Okay, many of you were here for that, right? Kind of comes back to some of these things, is being aware of that. We actually now, many of you asked last month, we have a dietitian now on board, right? Big hands, big things. She's actually here. Meredith is here. And she is a dietitian that's just joined on board. And as we'll talk about with arthritis, one of the most important things that we can do is consider the role that food plays within our body's wellness, okay? And that food is fuel, it's nutrition that is designed to help our body run efficiently. And whatever quality of stuff that we're putting into it determines how well this car is going to run, okay? And that's really key whenever it comes to this. So in going back to this, again, rheumatoid arthritis, don't smoke. Work on smoking reductions. Come to one of us and we'll be happy to help it with you. With gout, you want to make sure that you are eating eat a diet, a healthy one that's low in sugar, low in alcohol, because any of those types of things can help to trigger one of those episodes. And then if you have that other type of arthritis, then we're looking at really having a pretty, nasty few days here and there. So be aware of that. So understanding your treatment options, and this is important. Depending on the type and severity of arthritis that you have, the following options may be a part of your care plan. And if I've talked to patients all the time, and going back to diabetes again, I'll ask them, well, what type of diabetes do you have? The most common answer I get is, I don't know. Okay. That's terrifying. Because depending upon what type you have, depends your entire life and your entire treatment plan a lot of times. Arthritis is pretty similar to that. Understanding what type of arthritis you have can really help to empower you with what your options are and how you can best take care of yourself. So talk with your doctor about that. That'll be a helpful part of understanding your care plan. Whenever we look at this is the most common things that we would want to consider as part of it. Medications are generally a part of arthritic treatment, and that's because of its role in pain management. And with that being said, the most common one still advised, prescribed, and as part of the guidelines is Tylenol, okay? But some of this stuff, again, is going to be dependent upon what other comorbidities you may have, and in talking about this care plan with your primary care physician. The next type is NSAIDs. So here we're looking at Aleve, Motrins, Advils, and these two other medications that are provided by prescription. And so when we're looking at your treatment plan, we're looking at severity of symptoms and impact on quality of life, okay? This is in regard to your pain and how much it is impeding upon those different factors there, okay? Opioids are generally not considered ideal treatment due to risk. Truthfully, opioids are meant for short-term use, period, okay? Not long-term. That's been something that's been unfortunate that's happened, and it's a totally different discussion. So with that being said, it's not commonly given to people with arthritis, and it's generally not considered to be first-line treatment, okay? In fact, even the mechanisms that opioids work throughout your body's physiological system don't really work on arthritic pain as well as what these other things do, okay? Because those are specifically there to help out with inflammation. Other medications that could be given include corticosteroids, but if you have diabetes, this might not be a part of your treatment plan, because what happens if you sometimes give a diabetic a steroid? Blood sugar goes up. Yeah. So for you, that may or may not be a part of your treatment plan. That's also dependent upon the type of arthritis that you have. Now, there are newer medications that are also coming out, and they're referred to as disease-modifying and I have a hard time saying this word, rheumatic drugs. And again, those are prescribed for those folks who have that more rheumatoid-based type of arthritis that we tend to see. So dependent upon your type, the severity of your symptoms, and impact on your quality of life, this can be how your physician may direct you in terms of your medication treatment plan, all right? With that being said, there are also natural treatments that have been found to be very helpful, specifically within arthritis. And generally considered, supplements have not been looked on very favorably by research or by physicians, the medical community in general, because there's really not a good standardized ways to control vitamins or herbal supplements. They do not go through the FDA for approval, okay? So we don't technically may know exactly what's in that multivitamin, except the person on the label said that it was okay, but there's not necessarily a regulatory kind of committee overseeing these things as much as what there is prescriptive or typical over-the-counter drugs. However, what we have started to do in terms of research is really look at what people have been reporting and seeing if this is actually true in terms of improving quality of life, pain management, as well as mobility. And there's a list, again, on this website, the Arthritis Foundation's website, that goes through 9 supplements, and in each one of those different categories goes through the research that supports it, okay? And there are ones on there that I hadn't even heard of, and so I wasn't about ready to bring them to everybody here, okay? But that's just due to my own comfort level, and we're more willing to try things we've heard than things we don't know about, right? And so if you go on that website, look it up, check it out. I'm sure you can go to the Healthy Life Market or someplace like that and get some of those supplements if you like. But the 3 ones that we may have heard of the most and may want to consider are turmeric. Does anyone know what type of cooking turmeric's typically used in? Indian. Mm-hmm. So if you like that type of food, this could actually have some, a lot of health different benefits on it. But turmeric has absolutely been identified as something that really helps out with joint pain. Did you say it does? Yeah. Okay. It really does. Most times you can see treatment of, what is it?
My sister uses that all the time.
Does she really? And what has she found from it?
It helps them.
Mm-hmm. Most of the research that comes on this says that you will start to experience positive treatment effects from turmeric within 3 weeks. And that's about what you can expect for medications, true, like doctor prescribed medications in general. So turmeric. So how do you get it? What's its forms in? You can get it at grocery stores, vitamin stores. Again, I'd advise you to talk with your primary care provider before you start on a turmeric heavy or a capsaicin, as we'll talk about in a minute, heavy diet with things, because if you have, let's say, IBS or ulcers, you don't want to necessarily be messing with some of the capsaicin. And what you'll find in that is in chili peppers and things that are hot and things that are very, very spicy. But what happens when we eat things that are very spicy is it helps to release endorphins in our brain that actually fight pain. Okay? So it's interesting, but that we find that by eating these different types of foods, that it has this other effect on our body, which helps to improve our experiences. Okay? So again, looking into some of that. So you may not like to have, like, it's hard for me to eat incredibly like a hot chili pepper or something like that, but you could put a bunch of Indian, like turmeric and based foods in front of me all the time and I'd be happy to just kind of down it. So whatever's working best for you. Fish oil. Everybody's heard of taking fish oil with this. Things that are high in omega 3s especially is going to be really, really beneficial. There are 6 other supplements that are listed on this website. Again, it's included within your handouts. I encourage you to go to it, look towards it. The research articles that support it are also mentioned in it, so that way you know that it's very valuable. Going back to eating, right? And I'm funny as a psychologist because everybody thinks we talk about, like, you know, mental health, depression, whatever else. Main thing I talk about with my patients on a daily basis is, how are you sleeping? What are you putting into your body? And what are you doing with it? Those 3 things, okay? Because that dictates how we think, how we feel, and then what we do. And that whole process is connected to one another. And especially in conditions like anxiety and depression, what we put into our body often serves as an exacerbator for them as well. And so when it comes to eating, what we want to consider including in our diet, and on this website there are 12 that are listed, but generally speaking, looking at fishes, right, particularly sea fish, fish that has a lot of fats as a part of it, oils, okay, olive oils, the truer base types of oils, not necessarily the vegetable oil that, you know, maybe some of us are used to kind of cooking with here. Cherries. Isn't that interesting? So if you want to learn more about that one, go online and read about it, right? But cherries are part of it. Dairy, another piece to it. We may not necessarily want to exclude that as part of our kind of care plan. But, you know, as I've said in other presentations, and last month's presentation, even here today, the best thing that I believe that we can do for ourselves whenever we go into our primary care provider, and I know it's another appointment and I know that we're all busy and whatnot, but if you can get in to see a registered dietitian and talk with them about your medical conditions and what best kind of plan you need to follow on, you will do better long term with that singular appointment than with the years of just checkups, okay? Because food is our medicine. You know what I mean? Food, sunlight, fresh air, being able to kind of get outside is all a part of that. And it's also our illness. If we're putting, you know, a whole lot of like carbs, processed foods, you know what I mean? All of that kind of caffeine, sugar-based things within us, again, our body's not going to work and run efficiently. And so really sitting down with the dietitian and be like, these are my medical conditions. This is kind of what I'm experiencing, or I'm referred to you because I have this type of arthritis. What type of food plan do I need to be on? And they'll be able to help to differentiate some of these complicated things that just serve as barriers to us, right? So really, 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 if you're serious about kind of making these things happen, ask for that as part of one of your referrals. Even on the Arthritis Foundation's website, it has a whole list of healthcare professionals, and I'll have this up here if you want to see it after the talk, that may be included as part of your treatment team. And those folks include, of course, your primary care physician, your rheumatologist, an osteopathic medicine doctor, could be an orthopedic surgeon, a pain specialist, a psychologist, chiropractor might even be as part of it, a pharmacist, dietitian, and sleep specialist. Okay, sleep, why is that on here? How you sleep affects your perception of pain. Okay, it affects our experience of pain. And so that's a big part of this, and we'll talk about that here in a minute. Exercise, there's this old, I think it was on my last presentation, a meme, is that food is the most overused anti-anxiety medication and exercise is the most underused antidepressant. 100% fact. Okay? Anytime that we stop doing something, we get depressed. Okay? Period. And so movement, our bodies are designed to move. They are. By design, they're designed to move. And whenever we stop moving because of our experience or perception of pain, that actually makes our pain much worse. Okay, because then atrophy sets in. And then our energy level starts to go. And then we become depressed, which increases our experience of pain. And so it starts this horrific kind of landslide. And so being able to find a good, workable exercise plan that works with you, your schedule, your income is critical whenever it comes to this because it can really be helpful.
You know, medical science has discovered the exercise that's 100% effective.
Walking?
It's what you'll do.
What you'll do, anytime, right, anytime. Good point, I like that, that's a good quote. Yeah, you get it from anything. You don't have to be out running a 5K. You don't have to be out lifting weights, walking. I mean, that simply can be it. I know that some people say the joint pain, water. One of the best things that you can do if you can get into a water aerobics is to do it, but if you can't, the bigger investment that you can make when it comes to walking is finding a good pair of shoes. And you ain't gonna get them just going off the shelf. You need to go in and you need to talk to somebody. And they need to watch you walk. They need to see if you're, standing in certain ways, if you're pronating, if you're doing all this types of stuff, if you tend to step on one point or the other, because that can be contributing to your experience of arthritic pain, or that could even be causing further injury to your joints on top of that. So you will save more money long-term off of a good pair of shoes instead of investing it in medications later on down the road. So get those good shoes that may help out with that. And then surgery can be an option for some folks, like knee replacement surgery, shoulder replacement surgery, all these types of things that you're happening. Biggest point with that, again, is you've got to follow through with whatever the physical therapy recommendations are. Every single patient that I've ever seen that's went in for a second or a third joint replacement was because they didn't follow through with physical therapy in most of those cases. So what can you do in living with this condition? Well, first, just know your risk factors. Okay, that's a huge piece of all of this. Discuss your diagnosis with your PCP. If you've been given the diagnosis of arthritis, again, well, what type? What does that mean for me? What's one thing that I can then do to help myself out in my experience with this condition? Okay, you want to be that active member of your treatment plan. All right, nobody wants just to kind of walk in and be told what to do, because then we oftentimes don't do it. I mean, if anyone in here has a child, you know that that's the case, right? Everyone in here was a child, you know that was the case, okay? So be an active team member. Your provider's job is more effective and enjoyable even if you're participating in that with them. Understand your pain. And I printed off a few things on here. I actually had to put my email address and kind of get this sent to me, but this is a pain tool. And so if you have arthritis of any of the different types that we mentioned, being able to use some type of pain tracker, pain journal can be very helpful and effective in preventing major flare-ups with it and decreasing some of the severity of it and helping identify triggers and then helping to guide your treatment team in what's going to be best for you long term. And so I have some examples of that up here on the back side of it. It actually shows how you would kind of fill it out too. But this is key. Most of the time when I'm working with an IBS patient, diabetic patient, almost any patient, I'm least likely I'm going to ask you to do a mood journal, which is kind of weird, right? I'm a psychologist. I'm going to want to know what you're doing with these basic things right here, because these are things that we can really focus on, identify, and treat right away. because it's those types of behaviors with it, okay? What type of pain are you having? Is it acute, short term, or is it chronic, long term? And if it's chronic, then what's causing some of those spikes? Because you may be living with it all the time, but sometimes it's worse than others. So let's help to work with each other to identify what these things are, with these triggers. Remember this always. Number one trigger for any exacerbation of our health condition is stress. Whether that be COPD, whether that be any GI-based condition, whether that be a cardiac condition, an endocrine condition. The number one exacerbator, number one thing that's going to make it worse is always going to be stress. And this was even a direct quote from there. The way your mind controls your thoughts and attitudes affects the way your body controls pain. Amazing, right? Pain and the fear of pain can cause you to avoid physical and social activities, which can weaken your relationships, affect your mobility, and lead to more pain. So again, like we said a minute ago, if we're in pain and then stop doing, this is going to cause pain at other levels that's going to further impact us. All right? This is where we really want to be mindful of the role of stress and how we can work with that in our care plan. Coping. What we want to focus on is the modifiable risk factors here, okay? So weight. So we may already have this condition and we may have some concerns about our weight or our wellness when it comes with that. Reducing 5 to 10 pounds has been shown to decrease a person's experience of pain on that 1 to 10 scale, an average of 3 to 4 points. 5 to 10 pounds can decrease your pain that much. That's more of a long-term treatment effect than you would find from many other things. Okay? We're not talking about bunches, right? We're just talking about some increments there that can really help whenever it comes to that. Okay? It's, again, maybe not the best kind of analogy or metaphor in a sense. We're kind of fluffing the pillow whenever we take some of that kind of pressure off of those joints in that sense, okay? Giving us maybe a little less compression that's going to help. Smoking, again, especially with rheumatoid, we want to be mindful of that. Taking a look at what we're eating, exercise, and stress. Stay active, mind, body, and spirit. Yeah. And even if you don't subscribe to a traditional religious kind of belief system, having a belief system of anything helps, okay? Especially whenever we're going through something difficult or challenging. And so all three of those are key whenever it does come to our wellness. Now, whenever I say active, don't just think that means exercise, because there are some days that some of you that have arthritis that it's a feat, you know. It is amazing if you can get out of the bed and get to the couch, just because of the pain, the experience that you're having in that moment. But while you're on that couch, you can't just sit there and think about how much pain that you're in, or what you want to be doing, or how that you could have been doing this, that, and the other, because as we just talked about, that's going to increase your experience of pain, your depression, and the likelihood that you're going to sit there on that couch and everything's going to get made worse by the result. Not acceptable. Have an activity kit. Keep your mind active. If your body can't be in that moment, see it as that happening in that moment and do something to keep your mind busy. Now, a lot of folks that I work with used to be like needle pointers, right? Or sewers. And you can't do that if you got you can't just hold those things like you used to because of the joint pain, because of the knotting that kind of takes place. Okay, what's something else that we can do? You know, what's something else that we can maybe get to put in your hands, or that we can engage your mind in that moment that's going to kind of help out with this? So it needs to be cognitively stimulating. If it's, some people will say, well, I got macular degeneration, so I can't read like I used to. Audiobooks. Okay? You can get those at the library. You don't have to necessarily download some of these things. Anything that's going to keep your mind active and engaged can be helpful. There are different crafts that involve more gross motor skills than some of the fine ones that you can learn. I had a patient recently who really liked doing, I think, cross stitch. And you know, that's real fine needles, that's real fine thread. And what she's started to learn to do instead is that hand looming that takes those real big, thick pieces of thread, and she's just learned to kind of wrap it around and do it that way. Now, repetitive motion maybe, but for her doing it in those moments that she can't do anything else, that's probably a preventative factor for her in doing that, okay? Remain socially engaged. Talk with other people. I mean, we just mentioned arthritis is one of the #1 causes of disability. Many Americans have this. Many of our neighbors, our family members, our friends, sharing in that same kind of collective experience makes you feel better. It just does. It's a natural occurring phenomenon that happens. I experience it myself. Like I said, I'm a type 1 diabetic. Interesting, ironically, and rarely, my son is also a type 1 diabetic, okay? We both are able to look at each other and just know, because we both experience it, we both feel. When I'm around other type 1 diabetics, I feel normal, right? Whenever you're around someone else that has experienced something that you've gone through, you feel it differently. Whenever you're dealing with a condition that can be debilitating or life-changing as arthritis can become, talk about it, do something with it. Rheumatoid arthritis has a Jingle Bells walk that they do in Charleston. I think they have one here in Huntington. That really is very helpful. It's engaging. There's a lot of support systems that are a part of it. Try to find ways to get connected. Mindfulness to the moment. All pain experiences are temporary. This is by design of our body. Our body will not allow us to experience that intense amount of pain forever. It won't, okay? It does subside. But the more that you focus on it, it's kind of like poking the bear, all right? So you've got to, again, be mindful in the moment. This is tough, this is challenging right here, right now, in this moment. But you're going to be given another one, all right? And our challenge then is to decrease our sense of distress by having other things to distract and focus on. And that's even what we work on whenever you come with me. If we're talking about management of chronic pain, what else can we focus on besides pain? That may always be there. I get it. But so are other things. What do we got to do to get you focused on these other things right here? That's what this is about. Moderation, modification, and pacing. So in our day-to-day activities in living with arthritis, we may not be able to go at it like we used to, right? We may not be able to go clean the house, to fix the car, to take care of the lawn, whatever. Cook a meal, enjoy Mother's Day like we used to. But that's our expectation, and expectations are always planned failures. And so we got to be willing to modify our thoughts and just kind of see it as I'm going to do what I can right here and right now, and that's going to be that. Anytime we over push, we're out for 2 to 3 more days. And then we're just chasing our tail, okay? What you can focus on right here and right now, what you can do right here and right now to try to improve that experience is what it comes down to. Not always going to be rainbow and sunshine, right? And I don't think that it should be. But what we want to do is what can we modify, what can we do in terms of moderation, step by step, breaking things down, and how can I pace myself efficiently? Living with a chronic condition is a marathon. It's not the 100-meter sprint. Okay? If you take it like the sprint, you're going to get pooped out. Okay? Period. Right. Outlook is key, especially when living with this. That's kind of what I'm talking about right now. Seek support and continue your learning. The more that you're able to learn about your condition, the better off you're going to be. New research is coming out all the time. All the time. The more that you can get in touch with that, be a part of maybe different trials that may be coming out, to be willing to try new things that you've learned from your doctor, from a medical support group, or whatever else, that will help, okay? It's just being willing to do it. The resource, again, for all of this, and it's on your handouts there, was the Arthritis Foundation. There are others out there. There are others specific to your form of arthritis. Like I just randomly Googled and searched through a bunch of them. There's about a foundation for almost anything that you can find out there. make sure it has the .org at the end of it, okay? If you have a question, to make sure that it's a legitimate source, take that to your primary care doctor, all right? Sometimes we all get on the internet and Google becomes our doctor, but then there's nobody to treat us, okay? Google's not the doctor here. Your doctor's your doctor. So go to them with your concerns, with your questions, and learn how you can kind of better help to develop your care plan with all of this.